This is Ty Newell with COVID status report number 17. And today the main topic is looking at the change of infections per day, both internationally as well as among a number of states. This report is posted June 15th, 2020. As we mentioned previously, carbon dioxide, that's your gateway to knowing if sufficient fresh air is being brought into a building. Don't rely on airflow rates. Don't rely on others to say it's okay. You can buy a device like this for about $200, $250, and you can measure it. And the higher the concentration of carbon dioxide, the greater the amount of air that you are breathing that came from someone else's lungs. It's as simple as that. Standard ventilation practice results in about 1,000 to 1,200 parts per million carbon dioxide. If it's reduced to 800, essentially doubling the fresh air, you're cutting in half the amount of contagion you're inhaling from others, and that is going to reduce the probability that you're going to get an infectious dosage. So look at carbon dioxide. It's your means for determining if air is being properly managed. New York Times article this past week on June 12th on Virginia Tech professor Lindsay Marr. I've mentioned other faculty at our great academic institutions around the US and elsewhere, working for many, many years, not just recently on pandemic. And Professor Marr specializes in droplets and aerosols and how they evaporate, how they turn into droplet nuclei, how they are carried around in the airstream. So this article in the New York Times by Tara Parker Pope, The Scientist, the Air, and the Virus, it's showing what I've been saying for several months now, since the end of February, beginning of March. We need more fresh air. CDC needs to emphasize fresh air, filtered air, UV sanitation of air, wear face masks, and they need to get a spine and some backbone and let the administration know this is what's needed to snuff this thing out. Here's where we were March 30th as I began these reports, just as a continual broken record reminder. I'm sure it's getting old hearing me say this, but we were doing worse then, but we could have turned the corner like all these other countries. We could have been 1/10 of the number of infections and less than 1/10 of the number of fatalities. We would not have had to close our economy. We would not have had to spend more than $2 trillion on this thing. So it has not been handled properly in any way, shape, or form. The US now has over 2.15 million infections. Again, that could have been 1/10. We have nearly 120,000 fatalities, the worst in the world by far. That could have been less than 1/10. And now joining us in the top five are all the world's best known bullyocracies, the US, Brazil, Russia, India, UK, and racing to join the bullyocracies is the Saudi Arabian bullyocracy as they mismanage the infection too. And just as a note, Sweden's still stupid. Over 51,000 infections, about 5,000 deaths. In comparison, as we mentioned, Sweden and Norway were running along in parallel in the early days of the infection hitting both their countries. And when they were both reaching around 250 infections per day, Sweden chose a path that made no sense, still makes no sense. Norway decided to test, track, and isolate, and you can see the difference. Norway's infections are much smaller. less than a 20th of the fatalities that Sweden's had to deal with. And so definitely there's no argument, no debate about which has taken the better path, and definitely a lot less costly path as well. So kudos to Norway, Sweden. I hope you can get this into control. International predictions. The U.S., as of the beginning of July, but really any time, so this is a little bit squishy, plus or minus a week. U.S., your infections per day are going to grow. No ifs, ands, buts about it. That's where you're headed. This is like a slow moving steamroller. It is not a spiky thing of one bad day or another. This is what's built in over the past 2 to 3 weeks of incubation period and an infectious period for those who have the disease right now. And as I'll show in some slides, you're going to be increasing in infections per day any day now on a steady basis, and you're going to have trouble getting it into control. We'll look in more detail with some states. Germany, unfortunately, as great of a job as you've done containing this and handling it and minimizing fatalities, you're on a path that indicates you're going to most likely start seeing a steady increase in mid-July. United Kingdom, it took you a while. You're paralleling the US in poor management of COVID-19, but you have gotten it somewhat under control. But the indications are the beginning of August, your infections per day are going to grow. And Italy, you've had a tough time, you've struggled hard, you've gotten control of it. But the indications are that with the continuing trend, you're going to see an increase in infections per day in mid-September. How do I know this? This 2-week infection parameter that we've discussed over many of these reports, there's this limit. It's a very specific mathematical limit. When the infection parameter is 2.7, and remember, the infection parameter is essentially a measurement of over a 2-week infectious period, how many people one person will make infected. That number, when it's 2.7, it results in a constant infection per day number. And that means a linear growth in total infections. And when the infection parameter is greater than 2.7, there's an accelerating infection growth, an increasing number of infections per day. And when the infection parameter is held less than 2.7, and the lower it goes, the better, then there is a decelerating, a collapsing of the spread of infection. The US briefly held the infection parameter below 2.7, but it's now moving back above that boundary. So here's what the plot looks like. Here's the US, the infection parameter. We were up as high as 30 in the early days because of confusion, mismanagement, and overall lack of coordination among the federal government and the states. But we did bring it down. We brought it down below 2.7 in early mid-April. We've been bouncing around a little bit below 2.7 since then. This kind of fluctuation is a weekly fluctuation that is both physically real from the way we interact between weekends and weekdays. And then also, I suspect that there's time periods when reports are coming in more readily, say during the weekdays, and then less readily during the weekends that also add into this. But in general, this blue line that I have sketched through the data, and without formally going through some type of data smoothing analysis, but just eyeballing it the way we used to do it with a ruler and hand-drawn data, I would say that the beginning of July, where that red circle is, that's when we will start seeing on a fairly steady basis an increased number of infections per day for the United States as a whole. Germany, which managed the crisis much better, drew down to an infection parameter of about 2, really collapsed the number of infections per day and decelerated the growth. Now, as they're reopening and as people, and rightfully so, want to get out and enjoy a nice Hefeweizen in a beer garden. But unfortunately, this trend is indicating that probably about mid-July, your infection parameter is going to be going up above 2.7 with an increase of infections per day. When we look at the UK, similar to the US, you took your time getting it together. I guess it took getting your prime minister to understand firsthand the serious nature of this disease. But once you did, you took it down to a low level, which helped collapse it. But now you're on an upward sloping trend. 1st of August, if you don't change things, and it probably is very hard to change things during the nice summer weather, where people want to get out and interact. But the 1st of August, you can expect somewhere within a week before or after that, that your infections per day are going to start growing again. Right now, they're declining, but this is showing every indication you're going to grow by the first week in August. And then as we go to Italy, you led the way in showing how, when it gets out of hand, how to get it in control. You've struggled, and you got the infection parameter down as low as 2, and you've maintained it there, but now you're backsliding. You have a fairly gradual backslide right now, so I'm hoping there's room for you to get it back down. But unfortunately, with the current trend, I would say by mid-September, you're going to see infections grow again. The number of infections per day grow. On the state side, New York, you've gotten the infection parameter well below 2.7, but the trend right now is an increasing trend. And with your dense population and mass transit and poorly ventilated spaces around the city, early September, you should expect to see a growth of infections per day. Washington, Georgia, you've just crossed over the 2.7 boundary and you have an upward trend. So as of today, and anybody can see it in the data, your infections per day are increasing, as you're well aware, and the trend in infection parameter is that you haven't done anything to correct that. And so I expect the rate of infections per day to continue growing along with total infections. California, Florida, North Carolina, you're well above the 2.7 constant infection per day limit. You have accelerating total infections. Florida, you're growing the fastest. North Carolina and California, you're growing at a similar rate, but North Carolina, you're doing that with a higher level of infection parameter. So you're seeing a greater increase of infections per day than California, even though the number of infections in California is much higher. So I don't know what you're going to do about it, but you have to socially distance more, and you have to decrease the efficiency of transmission, wearing masks, increase ventilation, increase filtration of ventilation air, sanitizing air, unless you want to just continue to see this thing spin out of control. You've got to do those things. Ohio and Minnesota, you got things under control. You got below the growth limit. But right now, you're at an inflection. You're at a place where you could go up or you could go down. But the trend right now with the weather is to backslide. So you don't have any slack. And if you do backslide, you're going to be on a growing infection per day path too. Illinois and Michigan, out of these 10 states, are the only two that have not only kept the infection parameter below 2.7, but you're continuing to decrease it. You're doing a great job. Perhaps the scare and the out of control growth that you had in the Chicago and Detroit area and other metropolitan areas was enough to have you take it more seriously than these other places. But you've got to hang on and keep it going. So, right now, if you can continue on this path and then figure out how to open up while decreasing the transmission efficiency, while increasing social interaction, you can keep this thing in control. You can snuff it out and get it down to a test track and isolate level. So here's what New York, Washington, and Georgia look like. New York, it's a very gradual slope, but the trend is that you're going up. And probably about the 1st of September, you're going to see increasing infections per day. Even though right now at your level, you're still seeing the infections per day decrease. Washington and Georgia, you're both essentially above this line and showing a positive increase. So you're just going to keep seeing infections per day grow. Washington, I hope, because you know what you need to do and you've been doing it longer than anyone else to get this in control. So I hope you can respond and do that. Georgia, you were given a gift of good outdoor weather, a place that is fairly rural and without the mass transit of a New York City. So as hard hit as Atlanta is getting, that you are more socially isolated with lower transmission of the disease, a lower transmission efficiency on a naturally occurring basis, but you're going to have to get in control unless you want to keep seeing this thing grow as we're seeing in so many other places. Florida, North Carolina, California. Florida, you got below this line, you held below it for a period of time, but the quick reopening, and as I said, this is a steamroller rolling along. This is not a spiky overnight event. You opened yourself up to these events weeks ago. The trends are showing right here. And now you're on the fastest growth rate of the infection parameter, which means the fastest acceleration of infections per day of these three. North Carolina and California have similar growth rates of the infection parameter, but North Carolina, because you never really ever got lower in infection parameter, you're at an elevated level compared to California. But California, you never got this in control either. And now all three of you are just going to continue seeing more and more infections per day until you can get below 2.7. And I don't think this is going to be easy because you couldn't do it when the weather wasn't all that great and when everybody was primed for isolating and getting this into control. Ohio and Minnesota, as I mentioned, you were both out of control, but you got things established and into control and finally got a bit below 2.7. And now you're kind of in a holding pattern just below it. So essentially at a place where you're seeing about the same number of infections per day. And any backsliding, and instead of this line just continuing below 2.7, you're going to go above. And you don't have much room. That will be over a 1, 2, 3 week period. But we'll keep our eye on it and just see what happens. And then Illinois, good, tough work. It was so hard to get you below 2.7. You know the struggle. And now look at the past couple of weeks where you're solidly below an infection parameter of 2.7. I hope you can keep this trend going. The closer you get to 1, the faster you'll collapse this. You'll have to watch your borders as people are coming from every which way on your interstate system and through the airport into the state to test, track, and isolate. But keep it up. And Michigan, the same way. This wild excursion in infection parameter was due to reporting of data adjustment. There were a couple of days that didn't get reported, and then Michigan caught up, which kind of made it look like a surge, but it's really not. And the real trend is shown by this blue line, is where Michigan is. So you're doing a great job. Despite the protests to open up in a haphazard and uncontrolled manner, you've kept it in control. Keep it going. Get this thing collapsed. And the more states around us in the Midwest, Minnesota, Wisconsin, Michigan, Ohio, Indiana, Illinois, Iowa, Missouri, the bigger the region we can keep it controlled, the more we can collapse, and then the less we have to watch our boundaries to keep control. So I'm going to end on this. First, kudos to Illinois State University, a university that I'm a proud parent of, a ISU alum, and they recently released guidelines of what they're doing in the fall as they open up and bring people back to campus. And 2 of these items in particular, 4 times the amount of current fresh air ventilation. Excellent. You can't have too much fresh air. And the energy expense going along with that should be very small, maybe $50 per employee and student per year, without any upgrades in energy efficiency. And so it's well worth it. I mean, how much does a flu shot or whatever this new vaccine shot will cost? Fresh air is very effective at stopping this airborne disease from spreading. And you also said you're upgrading filters to medical level, to MERV 16 and HEPA level. And that will take virus and droplet nuclei containing virus from respiratory droplets out of the air. There's absolutely no question about it. And as I mentioned before, studies have shown that the droplets that are infected with a virus, unlike a bacteria, that these do not drop right next to where they are being emitted from someone's coughing and breathing. They tend to travel. They travel large distances. And a 10 micron drop takes a long time, several minutes to fall. It will get entrained by the wind of your walking past and go with you. And why CDC is not emphasizing this airborne movement of the virus and that as a significant transmission path, I don't know. But researchers at Harvard, at Virginia Tech, at Illinois Institute of Technology, at the University of Maryland, at Johns Hopkins, and many, many other institutions who have been studying this for many years, they know that this is an important transmission path. To conclude, 2 million is horrendous. It didn't need to be. But reopening, ignoring safeguards, interacting the way we would like to interact, this is going to result in 200 million infections. We are at the very beginning of this. We are only at 1% of what this thing will do if allowed to spread in an uncontrolled manner through the confusion, through the ignorance, and through the lack of coordination within the government. So we have to take this on ourselves. But 200 million infections for COVID-19 is what would give us blanket immunity. Remember, Sweden is stupid. We're being stupid. We need to avoid this path. There's a lot of death and destruction and cost if we don't manage this thing. Also, SARS-CoV-2, by now we know through all of the countries around the world in all of the climates, hot, dry, hot, humid, cold, dry, cold, humid, southern hemisphere, northern hemisphere, this thing doesn't care about the climate. It's not going away. It's not like the influenza that has a seasonal preference for cold and dry. SARS-CoV-2 is just among us, and we've got to snuff it out. And remember, even if a vaccine is found to be effective if it's like the flu vaccine, only means a reduction of 40% chance of getting infected. Increasing fresh air will reduce the chance of infections by at least that much. So don't pin your hopes on a vaccine. We need to manage this thing. Stay away from unmaskers in public. And then our guidelines. Increase fresh air to at least 2 times the current. Increase air filtration. MERV 11 and greater will remove viral droplets from the air. Consider using ultraviolet, germicidal, irradiation to kill another significant fraction of airborne contagion. Next week, we're going to talk about spikes and waves. What is a spike? What does it look like as we run our simulation model? And then the wave. As we talk about this second wave, it most likely is going to happen in the fall, and I'll show you what that looks like from the simulation predictions that I've been doing, and I'll give you the reasons for that as we look at that. Continue to use your masks, stay distance. Thank you to the essential workers, frontline staff, medical staff. You're not out of the woods, and all indications are your work is just going to continue to increase as we move into July.